Hello and Assalamualaikum. We are students of University Sultan Zainal Abidin. This video is for the subject Basic Pathophysiology that is conducted by Dr. AZMAHANI and Dr. HOLIFA SAHEERA. We are students of Dietetic. I am Syakirah and my group members are AAINAA, AFIQAH, NURBATRISYIA and AIMA. In this video, we're going to discuss about hepatitis. Contents included definition of disease, pathological disorders, the most significant clinical signs, and also diet and nutritional suggestion for patient management. Before we start with the video, I want to give you facts about hepatitis. According to the World Health Organization, 325 million people around the world have chronic hepatitis B or hepatitis C.
Hepatitis is an inflammation of the liver. The condition where acute and chronic inflammation of the liver caused by viral infection, autoimmune disease, medication, drug, toxin, and alcohol. There are 5 main types of hepatitis virus, including types A, B, C, D, and E. Hepatitis A and E are typically caused by ingestion of contaminated food and water, while hepatitis B, C, and D usually occur as a result of parental contact with infected body fluids. Common modes of transmission for this virus include receipt of contaminated blood or blood products and invasive medical procedure using contaminated equipment. For hepatitis B, the transmission can be occur from mother to baby at birth, from family member to child, and also by sexual contact.
Pathological disorder of hepatitis. The most common hepatitis is viral hepatitis caused by hepatitis virus and steatohepatitis caused by the fat deposition in the liver. There are 6 types of viral hepatitis. They are caused by different types of hepatitis virus. How does the inflammation occur? Infection at hepatocytes activates NK cells. NK cells create a cytokine environment. It then recruits T helper cell and cytotoxic cells to create inflammation. Factors that lead to either clearance or persistence of virus, strength of immune response, types of immune cells involved, and ability of virus to evade the body's defense. Persistent presence of virus creates multiple waves of inflammation that over time results in fibrosis and then hepatocellular carcinoma. In chronic hepatitis B and C, the NK cell function is impaired. Steatohepatitis is categorized by alcoholic liver disease and non-alcoholic liver disease. How does the inflammation occur? Accumulation of free fatty acids and their breakdown products in the hepatocytes triggers immune system to produce inflammatory cytokines that will induce inflammation, results in liver injury and cell death. In chronic injury, fibrosis lead to cirrhosis and culminate in hepatocellular carcinoma.
Hi, I'm AFIQAH. Now I will explain about clinical signs of hepatitis. There are several signs of hepatitis and one of them is jaundice. Jaundice is the yellowing of the sclera in the eyes, skin and mucous membranes. It is because of high level of bilirubin in the liver which leads to direct hyperbilirubinemia. How it happens? Conditions like intrahepatic cholestasis and post-hepatic obstructive biliary tract disease will cause the defect in the excretion of bilirubin into the bile. Hence, the conjugated bilirubin flows out of the hepatocytes into the bloodstream, which eventually increases the level of bilirubin in the blood. Next clinical sign is pale stool color and dark urine color. Loss of bilirubin metabolites from the stool will cause the color of the stool lightens. Water-soluble conjugated bilirubin metabolites are excreted in the urine, which will cause the color of the urine darkens. Meanwhile, water-insoluble metabolites accumulate in the tissues, which gives rise to jaundice.
Food to avoid: Hepatitis A. Avoid eating raw and improperly cooked shellfish. Boiling or cooking food and water for more than 1 minute to 85 degrees Celsius is necessary to inactivate hepatitis A. Avoid eating cold salad that have been served for a long period of time in a buffet lunch. Food to avoid: Hepatitis B and C. Avoid high iron food and iron supplements. Excess iron can be very damaging to the liver. Avoid alcohol to protect liver and allow it to regenerate. Go easy on fatty, salty and sugary food.
Hi, it's Syakirah again. The food for hepatitis patients include adequate protein intake for fighting infection and for liver regeneration. Chickpeas, broccoli, tofu, and almonds are some of the good protein for the liver. Also, plenty of vegetables and fruit to maximize free radical fighting antioxidants. We emphasize variety and color. Let's take care of our liver as it is a crucial part of our body. Thank you for watching.